Seizure usually lasts longer than that. And the typical way of differentiating, usually the patient, if they have not passed out, they will be very confused. They behave very strangely, become completely different out of character. But when they pass out or lose consciousness, they will have that typical stiffness and then jerking, and their head is backwards, their eyes roll back, and they become blue, they clench their teeth, and they make those noisy breathing sounds.
Okay.
That typically is a seizure. And then they can also lose control of their bowel or bladder. They can bite their lip or tongue.
Okay.
That's typical seizure. And then they are very slow to recover from that. And they usually sleep afterwards.
Could prevent someone from fainting.
Yeah, again, some of it will depend upon what kind of syncope we're dealing with. But generally speaking, I will talk about more of neuromediated syncope because that's a common variety of syncope.
Okay.
So vasovagal syncope, as we say, or a common fainting, is usually, as we discussed, is triggered by two things. Either there is something which drops your blood pressure and also affects your heart rate. We both of them combined can reduce the blood flow to the brain, and then you can pass out. So it can be triggered by situation like prolonged sitting or prolonged upright standing posture. So those who are involved in this type of like gaming for a long period of time in front of the computer, they will need to break that posture and do some exercise to make sure their muscle tone is maintained and also blood flow through the body is maintained. And those who are working in a like prolonged standing position need to break that posture. Either lie down, sit down, or what we also recommend is it is called clenching process or the posture. So what it means is like you clench your fist and then you dig your elbows into the side and you press onto your tummy muscle and it increases the blood flow.
Okay.
Or you cross your legs, cross your arms, and then make the muscles tense, and that also increases the blood flow. It's a simple kind of exercise, or you can say maneuver, which can help.
Yeah.
And the second thing which we must do is, as the blood volume depends upon, blood pressure depends upon blood volume, so make sure you're well hydrated. 1.5 to 2 liters a day. A simple guide could be your urine color. So try to keep it pale yellow, not dark yellow or brown yellow, pale yellow. 1.5 to 2 liters a day, generally speaking. Then we talked about the exercise, and the activities can also keep the muscle tone and also keep the vascular tone. Healthy diet, and in particularly, for example, making sure that you're reducing the refined carbohydrates.
Okay.
So if you're refined carbohydrate also not only health risk for other reasons, but also can reduce or increase your chances of having syncope.
Okay.
And therefore brown kind of stuff like brown bread or brown pasta, things like that, which are healthy.
Right.
Fruits, they're important. And then the other simple things which can be done is the changing posture and position in a slower fashion. In particularly those patients who are prone to have orthostatic hypotension.
Okay.
So taking it slowly while they are assuming the upright posture from the lying down. First, if they're rising out from the bed, they should sit on the side of the bed, give it a bit of a minute or so, let their body adjust to the position, and then assume the upright posture. So these are a few things which common things, or what we can say is a non-costly things which you can use
to prevent. Okay. So right, if someone needs a treatment, what are the treatment options to fix the problem?
Yeah. So again, most of it will depend upon your diagnosis.
Okay.
So diagnosis includes history, examination, some basic investigation, then advanced investigation. Like sometimes we'll do then cardiac investigations like echocardiogram, heart monitor. If we find that there is a problem on the heart valves on echocardiogram, or there is a problem in the heart rhythm on cardiac monitoring, they would need intervention. For example, tight heart valves may need cardiothoracic intervention, or very slow heartbeat may need pacemaker. A very fast heartbeat may need medication which can control heartbeat like beta blocker. And similarly, so vasovagal syncope is people who are very prone to get frequent episode of vasovagal syncope, interferes with their quality of life, then they would need some medications. And some of it depends upon investigation result. And the commonest investigation result which we do is the called tilt table test. And then tilt table test, if suggests a certain type of problem either with the blood pressure or the heart rate, we'll give them relevant medication either to keep the blood pressure up or to control the heart rate, like a beta blocker, or sometimes things like midodrine or fludrocortisone, which can also be used for orthostatic hypotension. So orthostatic hypotension, you can use simple measures like postural adjustment, as we described earlier, or sometime compression stockings. Or thirdly, if in patients who are still prone to have this type of episode or significant postural drops when they go upright, then we sometimes use medications like fludrocortisone, which can retain the fluid and the sodium in the body and keep the blood pressure on the higher side in order to maintain brain perfusion. There can be side effect of all these medications, but it is a balance between the risk versus the benefit. So just one point to add on, there's patients who are on fludrocortisone can lose potassium from their body. So they need to look into the diet to make sure their potassium remains on the higher side, and then think about consuming more bananas, avocados, dates, things like that.
You mentioned cardiac-related syncope, in which you mentioned like the patient might need pacemaker. So for our views, we have already covered bradycardia and tachycardia in one of our episodes where we mentioned in detail the function of pacemaker. Some of the syncope types, they are treated with the medication. I believe there are some side effects to it. So would you like to say a few words how serious those side effects are, and how do you manage, what is your advice for the patients to manage those?
There are not many medications we use for this group of patients. And as I said, it's mainly, if you look at it in more kind of like vasovagal syncope, orthostatic, simple lifestyle changes or, postural adjustment can also help to reduce the symptoms and even some cases control the symptom completely. In a very particular kind of a small group of patients where we do need to use the medication. And one of them, as I mentioned, is beta blocker, sometimes used, especially in a group of vasovagal or neural-mediated type of syncope. It's called POTS syndrome. It's called paroxysmal orthostatic tachycardia. They sometimes we use beta blockers. And the beta blocker, as you know, sometimes can reduce the blood heart rate, can also cause tiredness, fatigue. So these are the side effects. But again, patient will go on to this treatment after a thorough process of assessment and a specialist assessment as well. And similarly, patients who are like orthostatic hypertension, we commonly use something like fludrocortisone. And fludrocortisone is a medicine which works similar to a hormone in the body called aldosterone. So it retains sodium and loses potassium, but by retaining sodium, it keeps the water inside the body. And then it helps to keep the blood pressure on the higher side. And that in effect can also improve the brain perfusion. But obviously, if you lose potassium, the low potassium can also be a risk. Not only to causing the symptoms, but also sometimes causing significant heart rhythm problems. So things, making sure that in the diet, those patients who are taking these medication, they keep monitoring their not only blood pressure but also blood test with the health GPs or healthcare professional, but also make sure that they take things which contain potassium like bananas, avocados, dates, mushroom, etc.
Right. So another question I want to ask is there might be some people who work with heavy machinery or they drive car or ride a motorbike. What do you think, like how they can manage their syncope while they can, carry on with their daily activity?
This is a very important question. And that, as I said, it's important because if we get the previous things right, we can answer this question. Once you have gone through in a structured fashion and then you know what is the type of syncope you're dealing with, then you can give proper advice to these patients. So I mentioned previously is about ABCD approach. So A is the account of the event, which we've gone through, taking a good history.
Yeah.
And the B is obviously basic investigations, which we talked about is ECG, blood sugars, lying and standing blood pressure. And the C is the classification of the risk, which means what is the likelihood that this patient is going to have a further episode of syncope. We decide that on the basis of various risk tools. And San Francisco tool, there are other tools which are also used. But it mainly means how often the patient is passing out, what is the risk of cardiogenic cause of syncope, and what is the likelihood that it will happen again and cause harm to the patient.
Yeah.
And the D is basically driving advice. So that's very important. Once you've gone through A, B, and C, then you can address the D.
Okay.
And then what basically means that patients, if while through the assessment you decide that they have simple vasovagal syncope, it as such does not have any driving implication.
Okay.
Particularly to category 1 driver's license.
Right.
It can have implication on HGV drivers though.
Right.
But for motorcycle and car, it does not have significant implication, especially on the driving.
Right.
But you can understand if you're not sure about that what is the cause, and if you end up that this patient misdiagnosed as a cardiogenic syncope, cardiogenic syncope means they cannot drive until we have found the reason.
Yeah.
And as per DVLA guideline, they need to stop driving, inform DVLA, and they need to go for the specialist assessment.
Yeah.
Those who obviously operate heavy machinery, and particularly which can cause harm to not only to themselves but others, they will need to inform their manager, and they need to go through the occupational health assessment of their employer, and it may have effect on their employment status.
Yeah.
So it's very, very important that we go through the previous ABC process, right, to address the D.
Yeah.
And if you're not sure, why my advice would be is that always refer to DVLA guidelines, medical professional guidelines for driving.
Yeah.
And if it is a likelihood that they have a cardiogenic syncope or a seizure, then they are not allowed to drive until they have further assessment.
Okay.
Seizure, for example, means they can't drive for 6 months, and it can go up to 12 months.
Okay. Right. This episode is being watched in other countries as well. For them, DVLA is the authority who gives you the approval to drive in this country. So in other countries, might be different names.
Yeah, that's a good point, actually. But what I would say on that point, wherever country you are, if the patient once they've been passing out, they need to have healthcare assessment. Yeah. In order to decide what is the likely cause. And then they can affect on their driving status and also on their employment itself.
Exactly.
But generally speaking, if you had a vasovagal syncope, as long as you have awareness of this happening, and if it happens, you need to stop the car, wait on the side of the road. Yeah. That would be my advice. Yeah. But obviously, the previous background workup must be completed.
Completed, yeah. And the thing is, because it can be very serious, life-threatening, not only for the patient, but also for the other people as well.
It can be, and it's like sometimes we do have situation where, based upon our initial assessment, it is not very clear whether it is a seizure or whether it is a cardiac syncope. So we will advise in this situation is they should not be driving until the further assessment and investigation have been completed.
Yeah.
If they do drive though, then their insurance become invalid.
Yeah.
And they could be liable for all the damages.
Okay. Right. To sum up, what is your advice for the family and friends of the patients, how they can help the situation?
So the important thing is getting the diagnostic workup done, supporting the patient with getting the healthcare assessment and having those investigations done to decide what is the likely cause of it.
Okay.
If the likely cause, let's say for example, vasovagal syncope, which could be sometime recurrent, they can have the episode again and again, is to having that education and awareness of what does vasovagal syncope means, how does it look like, and as I said, mainly these patients will usually have a warning that they're going to faint, which could be in the form of feeling lightheaded, brain fog, vision diminishing, hearing can be diminished as well, and then a hot flush is coming over and sweaty and they look pale. If they look like this, that it means they might be having another episode.
Yeah.
So important is to help them either to sit down or lie down, depending upon where they are.
Yeah.
And then if they, for example, in the environment where they can pass out and injure themselves, making sure that environment is safe for them. The furniture with sharp edges can be moved away so that they don't get injured. Similarly, if they have passed out and you've seen them that they've passed out, put them in recovery position, left lateral, look, listen and feel, look for basically any signs of life, or if they're having any twitches or anything like that, listen to make sure their airway is not blocked and help to keep it open.
Okay.
Left lateral position or recovery position usually helps their breathing.
Okay.
And then feel means having the pulse, feel their pulse. If they don't have pulse, then you need to ask for help.
Okay.
To call the ambulance because they may need further, well, it could be serious then.
Okay.
And then making sure once they started to recover, don't let them stand up quickly. And ask them to, take it easy, relax, and then let them recover completely, and then gradually let them assume the upright posture.
Okay.
First sit them, then make them stand up slowly. And while they're lying on the floor, help to bring the blood pressure up is to raise their legs and the heels, and sometimes squeeze the calf will also increase the blood flow back to the body and the brain.
Okay.
So these are few things which they can be done, and then of course then helping them psychological point of view, emotional point of view, and also making sure they're having adequate hydration, good diet.
Yeah. So usually how long this episode lasts?
So typically, again, it's variable, but typically syncopal episodes are brief. They are usually less than 5 minutes.
Less than 5, okay.
And generally they're over within seconds to minutes.
Okay.
Seizure usually lasts longer than that. And the typical way of differentiating, usually patient, if they have not passed out, they will be very confused. They behave very strangely, become completely different out of character. But when they pass out or lose consciousness, they will have that typical stiffness, and then jerking, and their head is backwards, their eyes roll back, and they become blue, they clench their teeth, and they make those noisy breathing sounds.
Okay.
That typically is a seizure. And then they can also lose control of their bowel or bladder, they can bite their lip or tongue.
Okay.
That's typical seizure. And then they are very slow to recover from that, and they usually sleep afterwards.
Okay, right. Finally, any final words for the patients, how to look after themselves?
So again, for that, syncope, as we mentioned, could be psychologically have implications. So it's my advice would be, obviously, again, as a medical professional, to make sure if they have such episode, make sure they get proper assessment done. They have their initial, evaluation with the competent healthcare physician, and then they have their basic, and then, if required, advanced level investigation to determine what is the cause. While that process is going on, they may need some more information and support, and there are websites available.
Okay.
For example, in UK there is a very good website. It's called Syncope Trust and Reflex Anoxic Seizures, or Arrhythmia Alliance. They have a very good patient leaflets, and similarly NHS website will have leaflets on syncope. Well, the other lifestyle changes which I will advise to such patient is to make sure their activity level is maintained, as we discussed earlier on. Prolonged sitting or prolonged upright postures can decondition sometimes your body, increase the chances of passing out. Alcohol intake needs to be looked into to make sure their risk of having further such episodes reduced. Healthy diet, adequate hydration, including 1.5 to 2 liters, and clear guidance is your urine color.
Okay.
And apart from that, there are certain other things which can help. And they're like yoga sometimes can help. Meditation can sometimes help. Things, for example, cognitive behavior therapy in patients who are very prone to have stress and anxiety can also help to manage the situation.
Many thanks, Dr. Ilyas, for your time. I believe the information provided, our viewers will find it very useful.
Thank you. Thanks for the opportunity.
Many thanks for watching this episode, viewers. If you found this useful, please share with your family and friends. If you haven't already, please make sure to subscribe to this channel. Thanks for watching.